I see a live stream signal has come on, so we're going to get started. Good morning, everyone. Welcome to the Health Equity and Access Response Team. First, a couple of things about this meeting. It is a Zoom meeting that's being live streamed to the public. This is giving us the opportunity to continue to build our team here and stay transparent at the same time. The meeting is being recorded, so even those who cannot attend will be able to keep up with us. Asking that you please be aware of background noises, mute yourself when not talking. And also during our discussion times, I encourage you to keep your video on as much as you are comfortable and to help us to get to know each other. So in just a moment, I'm going to invite those folks who are with us for the first time to introduce themselves. I have about a 30-second description of who we are as a team, and then I'm going to invite newcomers to please help us get to know you a little better. We are, remember, the HEART team. We leverage our diversity to create new solutions so that as we respond to COVID-19, the entire community achieves optimal health and no one is disadvantaged. We extend our solutions beyond the public health professionals so that businesses, governments, civic associations, human service providers, and others join with healthcare to change our habits, our ways of doing business, so that everyone gets to have the best health possible. Finally, we use data in partnership with the community, the best available to us, disaggregated by race and origin and other relevant identities, to identify harms, make strategy, take action, and measure progress. Welcome, Dr. Asfar. Be sure to mute. At this point, I want to invite newcomers to the phone or to the Zoom meeting who are with us for the first time. Please introduce yourself. Please tell us your affiliation if you have one and what brings you to the table. All right, with no volunteers, then we're going to move right into what is our agenda for today. We got 4 things that we need to cover. We're going to do a COVID-19 update. Chris Hoff is with us. And as once again, so much has happened in the last 4 weeks, we're going to give some extra time to that update. We're going to spend some time addressing vaccine confidence. We're going to spend some time talking about race equity assessment, and with some closing remarks, some encouragements to people to take some action in their community. So let me introduce Chris for a COVID-19 update.
Excellent. Thanks, Dave. I appreciate it. And good morning, everybody. I'm Chris Hoff. I'm the Director of Community Health Resources at the Dupage County Health Department. And yes, grateful to give an update on the current COVID situation. I think the goal with these is always to give you kind of a current snapshot of where we see things, how that informs decision-making, answer questions, and try to help you get the best picture of what's going on as possible. A lot has changed since the last time we've met. We've had boosters come out and become available. We're pending a decision today from CDC's Advisory Committee on Immunization Practices about further expanding recommendations for boosters to all adults. The FDA authorized it this morning. CDC will meet this afternoon. We have kids now eligible between the ages of 5 and 11 for vaccine, which is really exciting. I have 2 kids in that age group myself. They both got vaccinated on the 2nd day, and we're not thrilled at the moment, but overall very happy and proud to tell everybody about their experience. And we certainly hope that that will help us get back to a closer sense of normalcy to the things we love and enjoy and anticipate about the holidays and school and all those. So I will move into the update. As always, we will post and share this information with you so you can draw from it in your own updates and use it in your communication as well. Dave, are you seeing a full screen or a presenter view?
I'm seeing presenter view.
Thank you. Can never tell, even after all these months. So always
full
good
screen.
to check. Excellent. So I'll start kind of broad with what we see in terms of community transmission, and then I'll provide updates on cases, hospitalizations, deaths, and then get into vaccine changes and what we're seeing. So the first is just sort of a snapshot from CDC's COVID data tracker about where we are in DuPage County. The set of data on the left is the raw data, kind of the metrics over the last 7 days. The one on the right reflects the percent change over the last 7 days. So you can see where we are and kind of where we've come. The unfortunate news is that we continue to be at a really high level of case activity. As of yesterday, we were at about 185 new cases per 100,000 residents over the last 7 days. That rate allows us to compare ourselves to jurisdictions of different size. And what's important here, and we'll go into this a little bit more, is that CDC's definition of high community transmission is anytime this number is over 100 new cases per 100,000 in the last 7 days. So we had gotten back down to really close to 100. Maybe the last time we met, we were flirting with that. And now our numbers have really gone back up. And so it is concerning. It's a little bit, we were kind of stymied on, why we continue to be at this high level. So if anybody has great insight, we'd love to hear that, because I think it's the question on everybody's mind. The good news, the really important thing to know is that the percent of our population that's over the age of 12, that up until the last 2 weeks, that was the group that was eligible for vaccine. We cracked that 80% mark. Remember, that was our goal back in April, was to make sure that at least 80% of those who were eligible were fully vaccinated. We're there. We know that has an impact on hospitalizations and deaths, the worst outcomes you can get from COVID, that have happened to our friends, to our family members, to our coworkers. And we want to do everything we can to prevent unnecessary death and illness to the extent that we can. That's public health's mission. I think that's why many of us are here together today, is to really make an impact. Hospital admissions, there were 79. And if you flip over to the right side there, you can see the percent change over the past week. So cases were up 25%, new hospital admissions were up 17%. So smaller increases in hospitalizations and deaths. That's important. That's really critical that we have made headway. We are making important strides against reducing unnecessary death and illness, but we're still seeing those things happen. This is, at this point, a vaccine preventable disease. And so we want to make sure that people have those vaccines, they understand the protection they offer, and know that vaccines aren't perfect. They're really important. And the best analogy I've heard is that, your vaccine is kind of like a really good umbrella protecting you in a rainstorm. And if it's raining, there's, a little bit amount of rain, even a medium storm, you're pretty well dry and protected. In a hurricane, it doesn't work so well. And so that's why we want to get our case activity down, because even the best vaccines, if you're throwing, cases at it every day, will not provide 100% protection. And we're seeing some of that now. We'll talk more about that. Again, CDC's definition of high community transmission is anytime that rate is over 100. We are at 185, so we continue to be at this high level. CDC also looks at the positivity rate. So we get a lot of questions about our positivity is lower than it's ever been. Why are we still at high transmission? Positivity is important because it tells us about the amount of testing we're doing, and we're doing more testing now than we've ever done at any point in this pandemic. Unfortunately, we're finding a lot of cases related to that. And so whichever metric is higher, that's where our community transmission level is, and we're over 100. We're not alone. The really frustrating thing, I think, is that many places across the country are seeing these high levels of transmission. The good thing is we're starting again to see some lighter colors on this map. If you remember, we've looked at this map, I think every time we've met. There are times when this map has been completely red, and over 95% of counties across the United States have been in high transmission. We're finally starting to crack that. Areas in the deep south, southeast that were really, really on fire 2 and 3 months ago are starting to recede a little bit. We know that infection with COVID does give you some immunity. So hopefully we're seeing some people with immunity from that. We're not out of the woods yet by any means. More people have been vaccinated. And what we see is that these cases have kind of rolled across the country. It's like a wave that, rushes in, and then after, 6 or 8 weeks, it kind of recedes. So I think the important takeaway here for everybody is that just because cases are receding doesn't mean that they're gone forever. Every time we've thought we're done with COVID, 6, 8, 12 weeks later, it comes back. So I think we need to prepare ourselves mentally and physically and everything else for the fact that, it's not a linear path from lots of cases to 0 cases and then we're done. Even myself, I feel like every time we get through that peak activity, it's like, okay, well, maybe now we're done. It may be that COVID kind of comes back in waves over the next few years as immunity from vaccines wanes, as immunity from infection wanes. And so it will be important that we figure out how to live with COVID in our lives going forward. I like these maps because it shows you the distribution of cases over the past 3 months. So a lot of times we hear wow, this place is doing much better. And I don't understand why we can't just adopt their policies. Well, their case activity, their hospitalizations, their deaths looked very different 3 months ago when we were doing pretty well. So in the bottom right here, you can see this areas of the southeast were really dark red with new case activity. In Illinois, we were a little bit lighter. And then things sort of rolled across the country. So we're seeing these waves kind of shift across the country. Illinois is kind of middle of the pack right now. We're the 22nd lowest state in new case activity. When we look at Dupage specifically, you can see again that we were down so low in June and July. We had days where there were less than 10 new cases being reported in an entire million people of Dupage County. Unfortunately, we saw that rise and really kind of hang out at this steady high level. On average now, we're seeing 254 new cases per day being reported. We're doing more testing, so of course we're finding more cases. But those are people that are infectious. So whether we find cases or not, those people who are infected have the potential to transmit disease to somebody else. So it really is important to understand where those cases are and try to prevent those severe outcomes. When we look at what's driving those numbers, we see this is the age group of cases being identified. So the legend on the right side there shows a couple of different age brackets. We see that the 0 to 19 group has the highest number of cases reported per day and has since probably early October, followed by the 40 to 49 group, 40 to 59 group in yellow, and the 20 to 39 group in blue. So we are seeing case activity kind of across the spectrum. Thankfully, in individuals who are over the age of 60, we continue to see lower rates. So those vaccines for sure are providing some protection. And that's a group that has experienced some very severe outcomes. So we're glad to see those numbers stay low. We want to keep them that way. When we look specifically in that 0 to 19 group to understand again kind of where those cases are, we see the vast majority of cases being reported in that 5 to 14 group of school-age children. That's one of the reasons we're so excited that vaccines are available. They're out there. Those individuals are eligible to get some level of protection. And should absolutely do that at the earliest opportunity. And we'll talk later about why that's important. But we hope that these numbers will start to see a downturn once that group gets more vaccinated. The older age groups, 15 to 19, certainly were much higher early in the pandemic and have stayed relatively low. So hopefully that's a sign of vaccines really working in that age group. And now we want to see the same in that 5 to 14 group.
Hey, Chris.
Go ahead, Mila.
Go ahead, Dave.
There's a question in the chat about what's driving the increased testing numbers. Do you have any insights there?
Yeah, it's a great question. And I think both of those things are true. So there is some mandated testing for individuals who are not yet fully vaccinated. So more workplaces are requiring that. The governor's executive order requires that for healthcare professionals and school professionals. So absolutely, we're seeing more testing. And then schools are generally doing more what we call screening testing. So they're screening, once a week their population of students who are unvaccinated. And we think that is really important, at least right now, because that group is not as fully vaccinated as others. So it gives you the opportunity to identify cases early and limit transmission. We'll talk later about outbreaks and where we're seeing cases. We know that when people are indoors, in close proximity to each other for long periods of time, that is a setup for disease transmission. So if we can identify cases before they are around people for extended periods of time, we will limit transmission. Now, as more and more people get fully vaccinated, that may become less important, but that screening testing right now is absolutely identifying more cases. And Jan, I think you're right on, the employee mandated testing and testing in schools is driving those numbers up. Great question. Thanks, Dave, for flagging me at any point, and I'll stop along the way to make sure we get a chance to answer questions. So I'll do hospitalizations and deaths and then pause and we can get some questions in. So in terms of cases, hospitalizations, and deaths, what we see in terms of who those are, overall, the average age of cases has been 39 in Dupage. In the past 2 weeks, it's 34 years old. In the past 2 weeks, 65-year-olds have been the average age of those hospitalized, and 75-year-olds have been those who have died. So I think just helpful to understand kind of what we're seeing there. In terms of hospital admissions, so we know that at some point, cases are really going to be less important for us to track individually because we will have people with immunity. We have some of these mitigation measures in place. If we're not seeing really severe outcomes, we know that that'll become less important to track cases. Hospitalizations and deaths will continue to be important markers to understand the severity. So there's a similar chart that shows the distribution of hospitalizations across the country. And we're seeing that same pattern of kind of rolling activity of hospitalizations across the country. So important when you look somewhere and say, well, hey, this place is doing this mitigation measure, or they're not doing this thing, is to understand where they are with cases, hospitalizations, and deaths. And I think this helps kind of illustrate how those policies may change and where we fit in across the country. Illinois, again, is doing a little bit better than the middle of the road. We're 19th in the lowest number of hospitalizations. We want to see that number continue to fall. In terms of outbreaks, I meant to put this after cases, so apology that it's coming after hospitalizations. We are continuing to track and investigate every new case of COVID-19. It continues to be a reportable disease. That may shift over the next few months as we get to a point in the pandemic where we know we're going to have cases continue. We may transition to other diseases that may be reportable when they're identified, but we don't investigate everyone. We will, however, continue to have a role in investigating outbreaks. When outbreaks are identified, we really want to help understand what's going on and prevent future transmission to avoid severe outcomes like hospitalization and death. On our website, and there's a link here on the bottom if you want to check this out and monitor it as we go. We update every week. Over the past 2 weeks, where are we finding outbreaks? Where are they reported in Dupage County? And you can see the different settings that we've identified outbreaks that include schools, offices, healthcare facilities, preschools. So we are finding cases in these settings, which is why these mitigation measures continue to be important as we get more and more people vaccinated. And you can track this on our website. We post this to help people understand where we're seeing outbreaks. We know they're there. We may not identify them in every situation. So this data is probably the tip of the iceberg, but we know that outbreaks have occurred in these settings. Our hospital admissions in Dupage, I showed you the national picture. In Dupage County, we continue to be at a moderate level of hospitalization, certainly much, much lower than where we were back last winter. We want to avoid that return. Again, we were back down in June and July to really low levels. We had a day or two where there were no new hospital admissions for COVID in Dupage County. Now we've continued to see the sustained activity of hospitalizations. Our hospitals report every day the number of people that are physically in the 6 hospitals within Dupage County. And you can see here that we're kind of in the 80 to 90 mark over the last 2 weeks for people who are in the hospital for COVID. The vast majority, over 90% from what we're hearing from our hospitals, these are people that are in the hospital because of their COVID diagnosis. Often we hear, well, you know, these may be people that are just there and they just happen to test positive while they were there for a knee surgery or for some other procedure. The hospitals are telling us that the vast majority of these patients are people who are there because their COVID illness requires them to be hospitalized. So we want to avoid these. These are people that don't need to be in the hospital for the vast majority of people. On the right are the metrics we've tracked over time for the region 8, which is Kane County plus Dupage County. You can see our ICU availability has bounced around this 20% mark, which has been the threshold for concern. Now, it's not all COVID patients taking up ICU beds. Hospitals are seeing more sick people with lots of other things, which just tells us we need to bring those COVID numbers down so that if you need to go to the hospital or a loved one needs to go for a procedure that's not COVID, there's space, there's people, there's infrastructure to take care of them. And we have unfortunately been seeing a rise in the number of COVID patients over the last 7 days. Our hospitalizations over time, again, much lower than they were back in November, December of last year. But we saw this massive decline in June. We were way down to very low levels, and now we continue to be at this sustained level. That's really kind of frustrating, honestly. And finally, before I stop for questions again, deaths, an important marker of the worst outcome you could possibly have. We see this pattern again of deaths kind of following cases, honestly, right? So they lag cases by a few weeks. And you can see that different areas of the country have experienced higher levels of death as their case activity has gone up. And you can see now that Illinois right now is 6th in the country for the lowest number of deaths. So we're doing much, much better. This should say deaths, not hospitalizations. And thankfully, we're at this level and we want to continue to prevent deaths from this disease. Dupage, again, in June and July had 0 deaths for a number of days. That was really incredible. I thought we were doing much better. I thought we were done. Unfortunately, we've continued to see 2, 3, 4 deaths a day from COVID that at this point are generally preventable conditions. And I'll stop there because I see Evan's got his hand up and I'll take questions if there are any.
Thanks, Chris. Helpful as always. So I think, this team especially did an incredible job getting everyone they could possibly find a shot in their arm and get them vaccinated. We're at 81%, which I know was initially our stated goal, and I understand that was probably set before Delta was taken into account. But are we doing better than those counties that didn't get to 80%, the ones that got to 60? Like, is that tier of high? Is there is that relative? Are there people doing worse than us? Or are we just middle of the pack like everybody else?
Yeah, it's a great question. And I do have a visual that's I'm happy to either add to the slides or pull up later that shows counties and their rate of vaccination and their case activity. We're absolutely doing better than places that have much lower vaccination rates. We know vaccines prevent infection, hospitalization, and death. The frustrating thing is that despite that high level of vaccine, we still see high levels of cases and hospitalizations. So I think we kind of assumed, and our understanding at the time was, if we got, to 80% or higher, we'd see really, really drastic reductions in cases, infections, and deaths. And while we have seen big decreases with Delta, that's more transmissible, so more people are at risk, we haven't seen that drop off to zero where we thought we'd be. So yes, absolutely doing better than places that have lower vaccination rates, but we're not at that point we had hoped to be, that, we get to 80, 90% and cases go away. And I'll pull a visual on that, Evan, if it's helpful.
Yeah, I mean, just kind of, it's frustrating. I think you said that it's frustrating, and I wish we weren't here and we weren't still still talking about COVID. I wish Hart could talk about other public health issues, but here we are.
Yep.
Yeah, and just to mention as well, I think that we have 80% of the eligible population who are vaccinated. But as Chris reminds me almost daily, there's still 350,000 individuals within Dupage County. We're not up to that 80% threshold for the total population being vaccinated. And clearly one element of that is eligibility. And now we have a few more individuals coming into that group. But the other is still the people who are choosing not to be vaccinated. So it does still seem to be, based on the research that I saw this week, that 80% does afford, of your total population, does afford some protection. But yeah, we're not there yet. So
quick follow-up to that though, are we going to change that metric? Because I know we're tracking 12 and older, but now that 5 and older is eligible to be vaccinated, are we going to change that metric, or are we going to keep it as a guideline?
Yeah, definitely update it. CDC has said they're working to post that data. It was supposed to be up this week, so I'm hopeful today that number gets updated. The value of using CDC's number is that it does capture people that are vaccinated at federal locations, out of state. That should be much smaller for kids, but it is a more complete number. So as soon as that's updated, we'll definitely be referencing that one. And I'll share a little bit more about what we're seeing in the 5 to 11s when we get to vaccine. Good question, Evan. Jan, and then Lynn.
Good morning. Chris, are we tracking long haulers? And I'm specifically asking about those who who get over COVID, but they have disease sequela, and maybe 3 or 4 months later. And I'm asking this question specifically because I just read a study that's showing that there is a higher, I guess almost substantial increase in deaths associated with heart disease in patients previously treated for COVID. So are we tracking that kind of data as well?
It's a great question. We are not at the county level, and I'm going to defer to Dr. Chug here in a minute. I've seen numbers that 10 to 30% of people who are infected with COVID end up with some symptoms that linger over time. And there are lots of studies and work going on now to understand what that looks like. I hadn't heard that number, Jan, on the heart disease related deaths. So I'd be interested in that. Dr. Chug, anything else you want to say about surveillance about long haulers?
Sure. It's a great question. It's increasingly recognized as a significant complication and concerningly and increasingly prevalent condition associated with history of COVID-19 infection. And in fact, I've heard it referred to as it's anticipated to be the post-pandemic pandemic, given the broad prevalence of it and just the disability, and as you're describing, Jan, potentially contributing to premature death further. So it is not yet a reportable condition. So we're not at the local level yet able to track it in our cases specifically. However, I know CDC and, through states and then sentinel surveillance, like through, representative a representative network of surveillance sites is tracking this, as well as many academic sites. And so we are kind of monitoring the information and recommendations associated with that. So we'll certainly, share back anything we learn, and then any data that we are able to compile and track at a local and or statewide level. Good question. Thank you. As well as resources. That's the other thing, is that I think it's, there are now cropping up some, post-COVID care or long COVID treatment centers, because it really does require a multidisciplinary approach. It's everything from neurological to cardiovascular to respiratory complications, not to mention the behavioral health associated complications. So it really requires that integrated, comprehensive approach to evaluating and diagnosing and caring for individuals impacted in such a significant way for such a duration. So yeah, great question. I think we absolutely need to keep this on our radar and share relevant data, recommendations, and resources going forward. Thank you.
Thanks, Rashmi.
And I was going to say, I see Lynn's hand as well. I'm not seeing everybody's face, so I'm not able to follow all.
Thank you, Chris. Thank you so much for such a detailed report. I love this information and it's so helpful. And thank you, as always, to you and Karen and your entire department for leading and guiding us through this pandemic. A couple of questions and statements. You said it, and then Karen said it, but I'm also going to reiterate it because I think it's so darn important that we connect these dots as close as possible for people. And the fact is, with this benchmark of hitting 81% fully vaccinated, because of the large size of our county, more populous than 5 states plus the District of Columbia, we are in a unique position. So when for having 350,000 people still unvaccinated, what that is always going to mean, if you're not vaccinated, the high probability due to the unbelievably infectious nature of this virus and the variants, you're going to get it. So those numbers, I think we have to just really hammer that home. These numbers will stay high until people get vaccinated. This isn't going to offer that sort of herd immunity that we were hoping when you have such large numbers and on this scale. So I just wanted to add my voice to that and keep driving that message home. My question is, would you be willing to speak about the news coming out of Europe and what the steps Austria just took in terms of dealing with their 4th wave? And if you see, in terms of what you were talking about, that pattern of the waves, how it moves through our country and obviously around the world, because since this is a global pandemic, if you can, and I know you don't have a crystal ball, but anything that you see from that 4th wave that Europe is experiencing and how it usually affects us down the road. Oh, you're muted.
Muted. Thanks. Yeah, it's a great question. I'm happy to start, and then Dr. Chugg or Karen or anybody else can jump in. The news and what's happening in Europe is really fascinating to kind of see, because it kind of goes to Evan's question of like areas that have really high vaccine rates. Some of these countries have vaccination rates, fully vaccinated populations much higher than we do, and yet they're still seeing surges in cases. What we're really kind of watching for, what I'm interested in, is whether you see that same really big surge in hospitalizations and deaths. I think the critical thing on the mitigation measures is that there's not a lot of appetite anywhere for more, really stringent measures to keep masks on forever or to require vaccine for some of these things. So I think for us, for groups like this that are really interested, is helping people understand the steps that they personally can take that are in their absolute sphere of control, and then how to advocate for policies that protect people in the workplace, at recreational events and entertainment. We see that this is a really infectious disease. Delta absolutely is twice as infectious as the original strain. So the number of people that are at risk goes up the more transmissible something is, because there's just so much opportunity for that to spread. It's really interesting to see what's happening in Europe. My crystal ball is broke, and I think it'll be really interesting. It's important to watch those. because we're not unique in the United States, that whatever happens elsewhere doesn't affect us. So I think it's really instructive to watch it. I don't know what'll happen next. Dr. Chug, Karen, anybody else?
I agree with your summary that I think it's difficult to say. I think the booster recommendations, the booster vaccine recommendations are all the more important. I mean, certainly we want to have all of our unvaccinated persons receive their primary series, and then because of waning immunity contributing to an increasing proportion of infections, though thankfully the vaccines are still proving to be highly effective in preventing hospitalizations and deaths, we continue to have a pretty relatively high burden of disease with ongoing transmission, including infection among our vaccinated persons. So booster vaccination will help reduce both the ongoing burden of disease and infection and spread in the community, and then most importantly, further reduce exposure to those most vulnerable to severe outcomes. Karen, anything you'd like to add?
No, other than the path forward and out of this pandemic continues to be vaccination and widespread support of not only vaccination, but other mitigating strategies such as face coverings and all of that. And so, yeah, I don't know how the US is going to navigate these next couple months, because I don't see that we have any different reason to expect a different outcome from what Europe is seeing. And yet we still have significant resistance to using the strategies that we have. I will say that I was struck in a very visceral way. National Geographic just did a documentary on the first wave. I think it's being released today. It reminds us of how vulnerable and traumatic the early days of this pandemic were, just based on the trailer that I did see. And, if there's any hope to be reminded, that by being reminded, that would help people grasp some of what we've already forgotten, the lessons learned, I would certainly encourage us to promote watching that. My concern is, though, that we've become so polarized with the politicization of this issue that may not even work. But yeah, it looks like it's going to be an extraordinary documentary.
And Karen, if I can just ask everyone to hold on to what you said, vaccine resistance, because we are not dealing so much more with vaccine hesitancy as we are vaccine resistance. And that is proving a very challenging population to reach. And I'm guessing David will touch on that a little bit later today.
All right, our next agenda item will be looking at how do we address that. I also see Julieta has posted a question asking, here in the Wheaton area, do we have a public post-COVID care center where everyone can access the needed post-COVID-19 care?
I'm happy to start. So that's an excellent question as well. And I was just trying to find a link. So I'll post that in the chat as soon as I'm able to. I think there's a website called Survivor Corps or something like that, but that does provide direct contact information to different COVID care, post-COVID care centers that are that have been emerging. Most of them are in the city with the academic centers. However, each health system is, even locally in Dupage, is establishing their own either center or referral network to address long COVID in inpatients. And I believe locally, Marion Joy being a rehabilitation hospital, has some additional services. But does anyone else on the call know?
Rashmi,
know,
I
Rashmi.
believe Edward Hospital has opened up post-COVID centers as well. I'm actually texting Colin right now to verify that.
Excellent. But yeah, maybe that's something that we can add to our compiled resources, is a listing with contact info of post-COVID care centers within DuPage County. Thank you. Kara, did you have
Kara,
something to
yeah.
add?
Yeah, no, it's a very brief comment. It really is just a bookend to Janice's, which I think was really well taken in regards to the difference between hesitance and reticence and outright declination. But I will say that it's probably, and the good news, although the complicated news, still a nuanced conversation. And that's because I am hearing from a good number of parents who I would still term hesitant, who have an intention and a desire for their children to be vaccinated, but do not want to have their children be the first to be vaccinated. So I think there are still some folks who are receptive to what the data can tell us and tell them. And so we should remind ourselves of that as well.
Kara, just to say this, I think I was in a meeting a couple of nights ago, ECHO, through the University of Chicago. Were you in that meeting? And it was pointed out that there are many physicians who have taken a let's wait and see attitude regarding their young children being vaccinated. So, I mean, again, that's another piece of this thing. We know our children in that young age group.
I was not in that meeting, but some of the people about whom I'm speaking would fall into that precise category. But they are themselves vaccinated and they have every desire for their children to be vaccinated as well. But they wanted to see a little bit more data on their especially young ones and any unanticipated side effects that might come through these first weeks. So hopefully we'll see those numbers continue to rise significantly.
Yeah, those are great points. And I think important totally reasonable. As a dad, 2 young kids, I think that is important. And it's critical to ask those questions and to get the information you need. So as much as we can help, if there's resources we can point you to for, questions about, well, how is it impacting kids? And are they being hospitalized? Are they experiencing severe outcomes? What side effects do they get? We want to provide as much of that information from good, credible sources as possible to give people that information. Those are great questions for people to ask. We would never harass people about asking questions that will protect their kids. We want to make sure the information is good and credible. So if there's resources you think people need or that we should be promoting, please let us know. That's really helpful to hear. Thanks, Jan and Kara. Jen, I see you've got your hand up.
Yes, thank you. So I'm a CHW and part of the DuPage County NAACP, and we are working with patients across multiple counties. And those patients are people that have currently COVID-19. And what we're seeing is a lot of people who have not been vaccinated or who have maybe received one vaccine and then they get sick. And part of our work is to try to encourage them to go get vaccinated later. But one of the things we're running into now that children have been approved for the vaccine is that we don't have resources to share. IPHA has not provided us with materials that we can hand out at events and that we can provide because this is so new. And I would really love to see some kind of collaboration happen where we can get more documentation so that we can appropriately share that information with the patients we talk to, because many have children, and also at events that we work on. And if I know I emailed Mila the other day about this, and I'm hoping that we can work on getting something, but the information is critical to getting the younger people vaccinated as soon as possible. And if anyone has ideas on how we as a group and can help out with that. And also I wanted to offer our help at events. If anybody has vaccine events with kids or any other vaccine events where we can participate, I would love to hear about it. So that's just my comment on that. We're trying to push this and help people understand that it's okay, but we definitely need more information. Thank you.
All of these comments are going to be a great part of what's going to be our next conversation about addressing vaccine confidence. And it looks like the next item that we do will have a broader agenda than town halls. We may be able to talk about educational materials. But Chris, I'm not sure, are you complete with your presentation?
I've got a bunch more, but I can squeeze it down or give it 5 more minutes. You tell me.
Well, I'm going to suggest 5 more minutes, and we want to bookmark these. There's a wave right now, a good wave right now of a call for educational materials. So we want to make sure that we bring that into our next strategy discussion in a couple of minutes.
Perfect. Then I'll zip through a couple of things. You'll have more material, then we'll send the slides. And so if there's questions you see after the fact that, trigger something for you, please do reach out. We want to give you as much info as we can. Sometimes we're biased to providing too much because we're just so interested in it. It's only the 674th day of COVID response, and it's gotten old, but we still have a lot to share. So we'll share the slides and follow up. I don't remember, speaking of messaging and kids and vaccine, did we share this last time? Have people seen this?
I'm not remembering it.
Okay, so this
Not
is a
in
really
this meeting, Chris.
Okay. This, I think, is a really important element of, promoting vaccines and promoting mitigation measures in our communities. That often we hear the message that like, well, it's only adults that die. Kids are fine. They don't get really sick. They don't die. Kids do get sick. Kids do have experienced death as a result of COVID. But one of the most incredible kind of heart-wrenching things that we've seen is this data that's coming out about the impact of COVID mortality, COVID death in families, and the impact that has on kids. This group, probably more than most, knows that these adverse events in childhood really set the stage for health over your lifetime. And a report came out in Pediatrics last month in October that said that between April 2020 and June of 2021, over 140,000 children lost a parent or a caregiver due to COVID. And so if we're not watching for these events, not looking out for these kids, we will experience adverse outcomes long into the future. And so the importance of protecting people from COVID and from severe outcomes like hospitalization and death extends beyond that individual to their families and especially to their kids. And the racial and ethnic disparities are evident here as well. And these families have experienced a higher rate of death than others. And so this is, I think, really important to help kind of broaden, our perspective on why it's so important to protect people. Absolutely, it's an individual decision, but like anything, the far-reaching implications are really, really important. And this is terrifying. And we know this goes through June. So we've seen this. This is pre-Delta. So the surge in Delta cases, the surge in deaths, this will be a larger number than it is today. And so I just want to draw your attention to that. We have some comparisons here we won't go into today, but we often get the question like, well, aren't we at a point where this is just like a bad flu season? And the short answer is no. COVID has been many, many times worse in hospitalizations and deaths and these really severe outcomes. And so we can come back to this if there's questions, but there's plenty of data that shows that COVID is much more impactful than a bad flu season. And we really do need to take the measures that we're taking to prevent unnecessary illness and death. On the vaccine number, so like Karen said and pointed out, we're at 80% of our 12 and up population. We're only at 69% of our total population. So when you look at the number of people in DuPage County that are fully vaccinated, it's about 640,000. So right now we're closer to 290,000 people out there that have not been fully vaccinated. The DuPage population is about 930,000. I think, I can't remember what the exact 2020 census number was. But we have about 300,000 people that have not been vaccinated yet. That's a lot of people. Lynn, you mentioned how big DuPage County as a whole is. 300,000 people is bigger than many cities and counties across the country. And so that is a big population that is vulnerable to infection and severe outcome by virtue of not being fully vaccinated. Now, some of these people do have some level of immunity potentially from being infected, but we know that immunity wanes over time too. We know that vaccine is really a durable way, especially with boosters now, to protect people over the long time. So we want to get that number as high as possible. It's great that our eligible population has taken up vaccine. We want to get everybody, and especially now that 5 to 11s are vaccinated. We know these vaccines are working really well. I'm going to skip some of these, but we can get into data about just how well these vaccines protect people from hospitalization and death. The data is excessively clear that if you are fully vaccinated, you are much, much less likely to get hospitalized or die as a result of your infection. This is a new chart, so I do want to hit this one. This is the percent of people who were hospitalized or deceased in DuPage County over the course of the pandemic. The blue line represents the percent of those hospitalizations and deaths in people who were not fully vaccinated. So the takeaway here on this blue line is that the vast majority, almost 90 and upwards of 100% of people in some months were not fully vaccinated, ended up being hospitalized or dying as a result of their COVID infection. Now, the bottom line shows the percentage of those hospitalizations and deaths that were in people who were fully vaccinated. And you can see this number has crept up from 0 when people were not fully vaccinated, or as people were getting fully vaccinated, had great protection early on. That immunity wanes over time. So this is why the boosters are so important, that we want to boost people back to that level of protection they had early on. And Dr. Chugg and her team have been looking at some data that reflects this more and more that we'll be happy to share in the future. Boosters, I'm going to skip all of this because the recommendations today, and I think IDPH, as we have been meeting, has come out with a recommendation that everybody over the age of 18 should get a booster dose of vaccine. So this will all change. You can ignore these slides and we'll have more information later today. The takeaway is that people who got their vaccine and have been at least 6 months out from their mRNA vaccine, a Pfizer or Moderna, or after 2 months of Johnson & Johnson should get a booster, and we'll update this information. I want to just hit kids really quick because I know this is a big topic, and then we'll stop there, Dave. So kids and teens, especially that 5 to 11 group that's become eligible, is a really critical group to get vaccinated. Absolutely, kids have been at lower risk than adults and older adults for severe outcomes, but it does happen. Kids can get infected. Kids can get sick enough to be hospitalized. Kids can die from COVID infection. We know these vaccines provide protection against COVID, and we want to keep kids out of the hospital and from dying whenever we can. That's the whole mission of public health. These numbers reflect the number of kids, the raw number of children who have been hospitalized each week between the ages of 0 and 17. So these numbers are very low. If you stack these against adults, kids make up a very small percentage of overall cases. What's important here is that just in the last few weeks, since August, we've seen the highest number of kids be hospitalized each week in that age group than we have at any point in the pandemic. Now, they're the ones that generally had not been vaccinated. So it's not unexpected that we would see more cases in kids who were not vaccinated as more of adults got fully vaccinated. But I think it's important to understand that we have seen more kids be hospitalized, and that's why we want them to get this protection through vaccine. In terms of our Dupage success, one thing I want to draw your attention to, because you may have seen stories earlier this week that Dupage lagged many parts of the state, had 1% of kids vaccinated. Turns out there was an issue with the IDPH data, and that was an inaccurate reflection of the current state. So I want to give you the correct information as we know it today, because I think this is an important part of boosting confidence in the vaccine, is to know that other kids have been safely vaccinated. So as of yesterday, 13,418 doses have been administered to DuPage County 5 to 11-year-olds. That means we're at about 16% of that age group having received at least one dose. That's awesome. For the first 2 weeks, remember, it's only been 2 weeks and a day that this group has been eligible. Healthcare providers, community groups, parents, community organizations have done an incredible job getting people to these vaccines. DuPage ranks 6th out of 102 counties for that rate in the past 2 weeks. We have an incredible network of providers. So 56 healthcare providers ordered 28,000 doses of vaccine in the first wave of orders. So we have really good supply. We have really good access. There may still be points that we don't have good enough access. So if you have insight in that or recommendations, we'd love to know and work with you to bring vaccine directly to those populations, either through our efforts at the health department or through other providers who can work with your communities. And Dave, I think I'm going to stop there, given the time. I'm sorry, I'm gonna do one more. Treatments. We have 2 treatments on the horizon that will also change the horizon of COVID. On November 30th, FDA is meeting to review Merck's request for approval of their antiviral drug to treat COVID infection. Pfizer also has an antiviral that has proven to be very effective in their clinical trials. We would expect in the next month or so that the FDA would review that one as well. This changes the landscape of COVID. Remember, a year ago, we didn't have these treatments. Now we have monoclonal antibody treatments. A lot of the treatments right now require infusion or you to go to a healthcare center. The change that these pills would have is that they would be at-home outpatient treatments that would reduce the severity of illness, would reduce the likelihood of going to the hospital or dying as a result. Whether you are fully vaccinated or not, these are important and critical treatments for us to have. So lots have changed. There is still a lot of unknowns that my crystal ball is broken. If you could find us a new one, we would love it. And I'll stop there. We'll share the slides and happy to take questions. We'll be on the rest of the meeting. Thanks, Dave, and thanks everybody.
Thank you,
I'll see if
Chris.
I'll see if we have room in the budget for crystal balls.
Well, 2 things that I'm taking away amongst the many, many, Chris. So first is that our job is encouraging people to open up that umbrella and protect our whole community that way. That's a great metaphor. And thank you for that last slide on treatments. That's our next challenge. How are we going to monitor and make sure the treatment is getting to everyone in the community who needs it and no one gets disadvantaged? So now what we want to do is switch to a proactive conversation about building vaccine confidence. And I want to invite Nicole and Jan and Mimi. I believe the 3 of you have been active in strategies for moving vaccine confidence forward. I'm not sure exactly how we'll frame this discussion or shape it, but could I just invite you to open your mics and help us talk about how do we do this well?
David, if you're okay with this, I have a meeting Sunday that I prepared a slideshow for. I can just go through it really quickly. As we, if I can figure out how to do this, you can share the screen. I mean, however that works.
So I see affirmation from Mimi and Nicole. How does that sound to you? Okay, good. So that sounds like the way to go. And so you need the ability to have your screen show.
Yes. And I think this is it. Okay. One of the things am I showing too much here? I don't know. Am I showing fighting COVID-19 vaccine resistance focus groups? Okay.
Right.
One of the things we agreed on was, especially with the African-American population and the low response rate in surveys, was that we needed to look at how do we better communicate and assess what the needs are in the community. And I'm not going through 19 slides. This is for another meeting on Sunday. But we're up against, as I said earlier, vaccine resistance. And this focus group that I met with earlier this week, the participants were recruited from a school here in Dupage County on what is labeled as Swab Thursday. Every Thursday, all non-vaccinated employees have to submit to a COVID test. And we incentivize the group by offering a $25 gift card to participants who agreed to participate in 2 focus groups. The first focus group is we listen to them. The second focus group is that we, in a safe place, we address their concerns. And one of the things that came out of this is it sort of changed my perception of how people think who are vaccine resistant, in as much as they are very committed to their beliefs. Some of those beliefs are fear. Some of those beliefs are the unknown. And what, okay, I'm not reading through all of this. And even with the attempt to recruit people, we had to circle back and personally reach out to every African American at that facility and ask them specifically, will you become a part of this group? And all 8 of them said yes, all 8 participated. And we did a preliminary survey to collect demographics. So we're looking at, I believe this is the male-female population. No, this is the population of self-reporting. All 8 participants work in Dupage County. 1 or 2 of them actually live outside of Dupage, but they all work in Dupage County. The 25 to 34 age group was about 70% of participants. And that's important because of that age group, 50% of them are parents. And these are people who are all opposed to the vaccine. So we have to consider, how do we motivate them? And I use that word intentionally because at this point, I think our focus needs to be more on motivating. And I'm not sure how we're going to do that. Hopefully after Sunday's meeting, I'll have a better idea. But of that group, 6 participants were female, 2 were male. And education-wise, and again, this is self-reporting, and I'm only saying that I have some concerns because we did a word association prior to the actual questions, and 100% of those participating in that word association game did not understand words that we hear every day about the vaccine and about COVID itself, such as risk and benefit, mortality, morbidity, longevity, and efficacy. I was shocked at this. 100% of the respondents did not understand these words or phrases. And I think that leads to some of the confusion around the vaccine, which tells us that we have to do a better job of communicating and helping people to understand the language of public health. That's not clear. Again, real quick questions. What are your concerns? And overall, in a comical way, they stated that there were no concerns. They just had no plan on getting the vaccine. But then as I questioned them further, the 3 top concerns was that it was made so quickly, not a natural substance to put into my body, and genuine concern about how will it affect my body. I think the message of what this vaccine will do got muddled, because some of them thought, well, if they got the vaccine, they would not get COVID. And now they're learning you can still get COVID. The fact that we have 3 vaccines is confusing for 80% of those participating. And the mandates, 1/2 of them actually said that was a problem for them, and that they felt the government was going overboard, and that raised their suspicion. And they also felt it was a way for population control. Again, we just collected responses. I'm not sure how that plays into this. The meeting I have on Sunday, we'll discuss that further. And this is a question I asked a group of Black healthcare professionals, what questions did you want us to ask this group? And this is one of the top questions. What vaccines, if any, do you think are safe and important? 20% of them said childhood vaccines are still safe. 80% said none of them are safe, and they only received childhood vaccines because their parents made the decision. So going forward, if they had children, there may be some reluctance for not just the COVID vaccine, but for others. 90% reported that they have close family members who got the vaccine. And when I asked what information would be most helpful to people who are still deciding to get the vaccine, not understanding the role of population health or public health here, and seeing this simply as something I should do and not taking the responsibility for the a public health crisis. Overall, they wanted to know, how will it affect my body? And a couple of them commented, everybody's body is different. So they do not see or feel that there's a public obligation to participate in the vaccine. Several were very adamant and saying no information will be beneficial because they're just not going to change their minds. Wanting again to know the ingredients and still thinking that the vaccine would change their DNA. Then we asked, are you willing to undergo weekly mitigation, testing with mask wearing? And they all said yes.
Hey, Jan,
Okay.
can I interrupt you for just 1 second and ask a
Sure.
specific question? When you were talking about the ingredients of the vaccine, because this comes up a lot, were they concerned about not the mRNA part, but the other things that are in the vaccine that they've heard are dangerous or cancer causing, or is there anything specific we could correct with clear information?
No. And I tried to get that out of them. I think there is a general lack of understanding. We talked about this the other day, Mila. Health literacy is a big issue here, and that may be something we need to address in our efforts to better communicate, not assume that people understand what morbidity is, what mortality is, what mRNA is, but just break it down in very basic terms so that people can get a better understanding. And I think, I'm sorry. Okay. And as someone who's taken that COVID test 3 times, I don't understand why someone is willing to do that on a weekly basis. That is the most uncomfortable test. And they don't necessarily see it as their business to promote the vaccine, and I guess one good side of that is to promote not getting the vaccine. They are pretty much committed to how they feel, and they don't want to leave it there. Now, this was a question that some of the physicians that I consulted with, Black physicians, asked me to ask, and that is, where do you receive your medical care? Overwhelmingly, they all said where they live. And for those who live specifically in the Dupage community, private healthcare, Edward Elmhurst Hospital, those living in Dupage, Will County, I'm being redundant. Now, the point of that is this one physician suggested that we probably need to better involve our actual providers, especially when it comes to submitting those surveys and getting and having them ask their patients to complete the survey. And finally, I asked a question: have you ever completed a survey from your health department or community health? 100% of the participants absolutely said no. They had never even received a survey. So but they do now have the survey, because I sent it to them for the Impact Dupage. They do now have that. And then the final question was, do you feel valued in your community? 70% of the participants said no. And I'm thinking on some level, maybe that's why they don't, they don't get the surveys to complete, but they don't feel a need to participate from a public health, what's good for the public, a societal kind of response to a pandemic. Thank you.
Oh my goodness, that's a lot. Wow. I think, Jan, the first thing that jumps out at me is the willingness of that group to participate in mitigation. This is not an in-your-face attitude. I can be unsafe if I want. That's really, really helpful.
Yeah, I'm interested in this.
Hey, any other reactions, other thoughts? What's striking you as you hear this new data?
Well, David, before that anyone answers, on
This is
Monday,
Chris. Yeah, I'm interested in the data about the students being willing to go undergo testing and masking. That's fascinating because we hear over and over that people are tired and sick of that. So it's interesting to hear that from a couple of students, small numbers, but it's fascinating that they would say that. And I do agree.
Chris, these are not students. These are paraprofessionals.
Gotcha.
Who work
Okay.
with students. But on
school.
Monday, Dr. Daryl Wilson is going to sit down with this group from Edward Hospital. He's going to sit down with this group and address the concerns. But Nicole, Amila, and Mimi and I are committed to continuing focus groups because we are understanding that in order to get the information we need, and part of that, and Nicole, you can elaborate more on this, is because eventually we're going to get into a post-COVID world, okay? And in that post-COVID world, because we don't want to go back to normal, we want to have a better engagement by all populations and how we go forward with our plans to provide opportunities for everyone to have optimal health.
Yeah, I think you captured that right, Jan. As you reported, I think there are certain races and ethnicities and populations within the county that don't feel very engaged in the community. And so, again, that plays a role in vaccine hesitancy and also kind of the accountability that they have to get the vaccine to the public. And part of the work that Mimi and Jan and I are working on is really building trust in those communities, and that takes time to do. So we actually reached out, Jan, to remind me, was it the Black Club leader, Prevail?
No, she's actually with Black Lives Matter.
Mm-hmm.
She's one of the leaders with Black Lives, and she was actually referred by Mimi.
So we reached out to her, though, because we want to learn more about specifically the African-American populations in Dupage County. And even beyond vaccine hesitancy, their health and social needs and their health and social barriers, to just learn more about that community. Again, some of the social needs that we may not have addressed, but need to. And so she's a starting point kind of to get more engaged and to hear more from that community. So we're kind of starting small with this and hoping to convene town halls or community meetings just to hear more about, their concerns, why they're not as engaged in the community, social barriers, what they would like to see more of. And so even to Jan's point, beyond the pandemic, beyond the vaccine, it's really important to understand the needs of the community, understand the cultures of these communities before kind of pushing, if I will, vaccines, which I'm all for, obviously. But it's important to engage the community beyond vaccinations. That's all that I would add. Thanks, Jan.
Yeah, and I would just add that to echo the importance of building that relationship and maintaining that relationship over time versus kind of a one-shot, thanks for the information and we're out. So what are the strategies we want to use to build that relationship over time?
And I'm hoping, because of the 17 people who were asked, and I believe, I think I said 4 or 5 of them were, one was Hispanic and the other 4 were white. I'm hoping that we can take these focus groups into those communities because there is still a significant resistance by some of our white, particularly religious groups. And I think to ignore them is a mistake, but we need to better understand what their concerns are. And I think I shared this last night with Karen. I walked away with a whole different level of respect for these people. I didn't walk into the meeting feeling that respect, but I left that meeting feeling a respect for these individuals and honoring them and where they are, and with the promise that we will come back to you with good information.
Yeah, Jan, I couldn't agree more with to overlook the feedback and to discount the feedback is a mistake, but even more, it is disrespectful and does not really embrace the values that, you know, we I believe strongly hold in DuPage County. So I think the work that you guys are doing is phenomenal, so exciting. We have talked about disparities in health outcomes. The two in particular that I'm familiar with because of my work is the rates of breast cancer in Black women, and as well as infant mortality and preterm birth. And again, you know, we're not exactly an urban core that you can explain away those kinds of disparities. So I think that your focus on how we can leverage these valuable relationships and voices for not only COVID, but for all of these other things which have such a profound impact on the health of our community is just phenomenal. So thank you.
Hey, Dave, I wonder if Sarah or Julieta or Sue or anybody has any feedback on those same issues that Jan brought up, just from the, you know, feelings in West Chicago or even in Bensonville, some of our other communities too.
It is interesting. I find this, I'm Julieta. It is interesting. I find many things that Jan brought out that are, we confront my group and I, these, I think it is very important that we make sure we are trying to speak to them with words that they will understand, and in our case in Spanish. And it's our community is trying. I think they're kind of turning around a little bit, not much, but it's I think it's very interesting. Yeah, there is specific concern over their kids right now, whether or not to vaccinate them. And this is what we'll need to address in a way that their kids will understand. You know, why is it important for me to get a shot? I think maybe that if we could come to the children and talk to them at their schools in a way, I don't know if their schools will allow it, or even like at our facility, if somebody would come and we bring children to listen and then let children talk about among themselves in a circle group, maybe they can convince each other that it is important, and maybe that way, sometimes kids have a better way of getting to their parents, telling them, I need to get a shot, Mom, you know. And sometimes, you know, being a mom myself, I've had to listen to my kids many things, and I've turned around and said, okay, I need to do this for my kid. So maybe touching the children in a way that's permissible, you know, that's a sensitive issue. But if there's a way we can get to the children to understand they need these vaccines, maybe they'll tell them, we need to do this. Mom, when am I getting my shot? You know, I think maybe that way we'll get to be able to vaccinate most of the children. So, and yeah, just make sure we have the verbiage everybody will understand, even a child will understand. So
Hey, I could springboard Mila's invitation to Julieta and Sarah and Sue to really to the whole group. Um, Dr. Asfar, Jen, Michael, I'm dying to know what people are thinking about what you heard about this. How does this apply to the world in which you're working? What can we draw from it?
Hi, David. Can I say something?
Please.
So first of all, it seems like that I'm meeting after a long time. It's so good to be back. And thank you so much. It was a very nice presentation by Chris and learning about data and all the hard work which Jen is doing. I think it's important to convey share same data to the community at large, that we are in the red zone and we are at the highest level. This is very important. But I was looking at MENA numbers, which Chris just shared, and the numbers which are showing is 45. So it's kind of it's again, it needs a lot of work, and I think that organizations like ICNA Relief are super busy in providing other services, food, other basic necessities, and we really need to focus in this area that we have basically nothing. I know for a fact that the community which I serve, first of all, they are low income, low social income group. They earn less than $20,000 per year. So they have so many important needs: how to pay the rent, how to find the food, how to get the car. There's so many things happening in their life. And then communication is a huge issue because we are not there to provide the communication, and then whatever we are providing, it's in a different language which they don't understand. And so we really need to sit and discuss, and go in detail that how we can get the data, especially for kids, because there's a huge hesitancy in this community to give this vaccine. They are okay for themselves. They say, okay, give me the vaccine, but not for my kids. No. There is no data, there's no information for them. Maybe there is data available, on the websites, but they don't have internet, right? They don't have time to go and browse and read and translate. So we need to do a lot more. But thank you so much. It's been so good to be back and see everyone.
Very good to see you. Thanks for that feedback.
Hey guys, can you hear me? Hello?
Oh, yeah, it's a very slight voice in the background.
Can you hear me now?
Sarah, I can't tell if that's you trying to, I know you have your hand up. No?
No, I was hearing a small voice asking if she could be heard, I think.
Yeah, it's me, but I don't think my microphone works, so I'm not gonna take it.
Hey, Sue, it's coming through now.
It
Speak
is?
clearly, or we'll get you. Yeah.
Okay, can you hear me?
Yes.
Okay, so what I want to say is our community has the same concerns that have been expressed during the meeting and the presentation. And what we have been doing with Julieta and the team in Casa Dupage is we have been finding the information out there that is in English, and we have to translate because there's not a lot of information in Spanish. And we are putting it in a way, like someone just suggested, that people will understand it better. We simplify it and we offer a view based on, that is more, that is going to be more acceptable to them. And so maybe in that way, we can convince them to get the vaccine for the kids. And I must say that at the beginning, I was also reluctant to give the vaccine to my kids. I'm vaccinated, but I was a little reluctant to vaccinate my children. Um, and I had a coworker. I was having a conversation with a coworker this week, and he opened my eyes. on something that I should have known already. He shared to me that he had vaccinated his kids, but he was so happy and so excited, and I could see that in his face. I could see the happiness and the relief that he was sure that even though they would get sick, maybe, he knew they were not be needed to take to a hospital. So when I saw him and I felt that energy, I'm like, I'm not doing a good job here. I have to have that attitude. I need to be happy, have a smile on my face when I talk to people. And so I think that is something, is the approach we are taking right now. And I just keep sharing with us the information out there. We'll do our best to pass it to our community.
Thanks, Sue. That came through real clear.
May I make a request, and it might also be a suggestion, but in my experience, it was actually very helpful. I'm hearing, and I know a lot of folks are reflecting, that they themselves feel like they don't have the tools that they need to respond to specific questions that are coming their way. And I've had circumstances in the past here at Dupage Health Coalition where we had the same experience, and we reached out to the health department through the COVID helpline, and were able to get some help from our colleagues in public health, forwarding along materials to us that were sort of targeted to the particular need that we were trying to address. And I'm just wondering, I know that our bandwidths as organizations are stretched very thin, but it would be great to know whether or not that sort of responsive tool procurement was still something that the health department was able to help with, or if not, if there was another resource that we could identify where, rather than sort of saying it's out there, they say not the equivalent of a research librarian that says, yes, it's out here and here it is, here is exactly what it is that you're looking for. Because it seems as though that might be something that would be helpful and welcomed by many.
I agree with that, Kara. And the other thing that I was going to say is that although the community work has been really important, because this has become so polarized, I have been in municipal meetings in a variety of areas, in different school district meetings, and leaders. Even we have this grant in West Chicago, and I'm having a hard time finding hosts who will allow us to make a clear statement that getting vaccinated is important. They will say, oh, well, you can present the information, but please don't tell people that they need to be vaccinated. It's a personal choice. And although, yes, it is a personal choice, I fear that we are not having messaging from our leaders in a consistent manner to say, this is safe. This is the way to keep our kids in school. This is the way to keep our businesses open. It's not a consistent message, even at leadership level. So then you have these trusted people like the few pediatricians who aren't willing to vaccinate their children yet. Then the people who are the least hesitant and the least resistant hold on to that statement, or hold on to the statement of the municipal official or the superintendent who also won't make a clear statement of, this is important, this is safe.
So I just want to ask, there is a huge convention coming and by end of December by, MENA community, you would say most of the population from the Middle Eastern and North African. And I believe the participants will be close to 25,000. They will be from all over Chicagoland area. Some of them might come from out of the state too. So is there a way we can, from DuPage County, I know it's in Chicago, but many of the participants from DuPage County will be there. Is there a way we can, share the messaging and share some resources which we are creating here in DuPage County to that community? Maybe we can discuss offline.
Dr. Asfar, I have a thought about that in terms of mutual support. Our work on data disaggregation has brought us into relationships with members of the Arab American community, the MENA community at UIC, as well as our neighbors in Michigan at Access, a community health organization there. They have put a lot of resources into messaging. We might be able to do this as a two-way exchange. Use that gathering as a way to share our messages, but also I want to reach back out to folks and say, what have you got that will be helpful to us that we could amplify or adapt to our circumstances? And I thank you for that idea.
And David, that sounds like another collaborative effort, right? Okay, and what I'll keep you in the loop because I think this is an issue, and Sarah, you spoke that very clearly, that the communication piece has been sort of muddled. And yesterday, someone reached out to me from another county. I'll just say the largest county in Illinois. Okay, they're trying to put together a group to figure out how do we better communicate information, and particularly in marginalized communities, about COVID and the vaccine. So I'll bring up the Heart Group when they set up that first meeting.
Very good. So we're at 10:29, and let me see if I can kind of pull some things together. We've had some great, an important wave of appeal for help with education and information about children's vaccination. So we want to find a way to give that some focus, number one. As we've been talking here, a number of resources have been dropped into the chat. And I know many of you like me are pulling those off as they're coming in. And Mila, will we be able to share those afterwards with the group so people will have those in hand?
Yes, Penny's been really great about making those available. So we'll get those back to you. And I'll send a follow-up email with the flyers and things we talked about and Chris's presentation. I know Dr. Chug had some additional things she wanted to share too. So we'll try and wrap all that up in an email.
All right, very good. So also, I know there are two big questions that are in front of us, and that is who can take the lead for kind of consolidating that information, not just what the great thing Mila's about to do, which is to share what's been shared here, but to kind of be that research librarian who will keep us posted about what's available when and what will be helpful to who. That's an open question. The second is how do we get, what are the right resources to get into the current activities? Casa Dupage, you mentioned that you're having a vaccine clinic. You'd love to have somebody come out and talk about children's vaccinations. And I'm sure that there are other events that are planned that people are looking for resources for. So that's another question for us. And we want to come up with a list of folks who could speak to that and who would be available and willing to piggyback on existing activities. Those are two things that come to my mind. So what's going through my mind is how we sort through that is perhaps Mila, I want to ask you kind of in live time, do you think we could do a communication subcommittee and put that on the agenda to say, how do we sort through who will take the lead on these elements, or what's our way to manage through this with everybody's bandwidth limited?
Yes, we could do that. And the subcommittee did meet this week just to quickly kind of prep for today and to, again, felt like there was so much information between the last meeting and this meeting. Especially with the very quick ramp up for the pediatric vaccines and meeting the demand for that. So yes, the subcommittee can meet again. And I think that leads nicely into the December dates that we probably need to look at, because that feels like a really short month. So I'll let you take it from there, but we should talk about that.
All righty. And one thing also I want to do before we close, I invited Michael to open up his screen in case he had a response to that earlier conversation. And Michael, I see you there. I don't want to lose the opportunity if you also wanted to weigh in. Now you're frozen, so we'll move forward. So what are our meeting options in December? Do we want to pick a Friday morning, 4 weeks from today?
I think the 10th is a little earlier than we would normally meet, but given the timing, the 17th would be the other option.
17 at 9. Very
That
good.
sounds good.
I want you all to know I've dropped into the chat one more way for you to message to your network about the importance of setting the tone, the input, the information for our community health planning in DuPage County for the next 3 years. Right now, there is a landscape survey that is collecting information from individuals about what's going well and what needs attention in the county. We're at risk that majority white voices will be overrepresented. We're at no risk that minority or diverse voices will be overrepresented. So I want to encourage you to think on your Rolodexes, your contact managers, your lists of friends. Who are people that you could individually reach out to and say your voice is important? And look in the link here in the chat here, and I've got a link. We have this posted on our site, but you'll also find it, of course, at the DuPage County Health Department. I'm sure you're going to find it at the DuPage Health Coalition and many other websites around town. We also,
if folks have a means, Dave, if I can add to that, if folks have a means to either consider using text messaging to reach out to folks with a more direct invitation, or perhaps posting the link on WhatsApp or whatever tools might be a place where folks would be receptive. We have had success in some of our prior survey efforts in this past year at reaching a broad and truly representative audience in at least some of the groups we serve. And we really want to make sure, I mean, this data will inform a 3-year planning process. So it would really be tragic for it to not reflect the community in the most inclusive way.
And you know, Kara, I think so many people don't understand that. And as I've been sending the survey out, I've been trying to explain, you know, it is absolutely impossible for us to close the health gap without you participating in this, because our health departments, our hospitals need to hear your voice, and this is your opportunity. So I think we just have to all keep conveying that message. If you want your voice heard, you've got to complete the survey.
Thank you for your efforts. Thank you sincerely.
and do we have someone who wants to make an announcement about World Diabetes Day, November 14th? Or will that suffice to keep that in mind?
I think that will suffice. If anyone was doing anything special, I thought we could acknowledge it, but I know social media has been a great place to do that, and we didn't want to lose sight of a very important Awareness Day and really carrying that message forward through November during this month.
So I want to say to everybody then, thank you so much for your action in the community. Thank you for your voice here today. Thank you for the new understanding that has arisen about what we need to be doing to be timely and to be protecting our community so that everyone is well and no one is disadvantaged. I'm going to bring us to a close. We adjourn here and we'll get back together again in 5 weeks. Thanks so much.